நம்ம IVF ஓட myths பற்றி பேசலாம். ஸோ IVF அப்படின்னா, is there something wrong about it? It should not be done. Is it necessary for everyone? Definitely it's not necessary for everyone. So where there is some clear-cut indications, அதுக்கு மட்டும்தான் IVF definitely தேவை. If at all it is necessary, it comes as a reality that it has to get it done அப்படின்னு எடுத்தா, yeah, it can get done because it's not a completely artificial procedure. It's an assisted procedure. Normally நடக்க வேண்டிய ப்ராசஸை என்ஹான்ஸ் பண்ணுறதுக்கு the medical assistance is provided from the help of drugs and injections as well as in the lab for the egg and sperm to mate and form an embryo. So definitely IVF is not anything wrong. It just helps the couple who are in need of it to have their baby and a pregnancy in a successful way. So that is what is IVF. The second myth is like, how many times IVF has to be done? Generally we say like nowadays, because in an IVF, once you do an IVF, you get sometimes plenty of embryos. So the actual cycle of IVF is once, but the number of embryo transfers becomes many. So the actual cycle of IVF can be done up to 4 to 6 times. So within that safety limit, usually it does not cause any problems at all. Third thing, does IVF result in cancer or any malignancies or any health problems like diabetes, hypertension? Definitely not if it is performed within the limits. And basically ஒரு கப்பலோட அண்டர்லைன் மெடிக்கல் கண்டிஷன்ஸை அசஸ் பண்ணிட்டு அதுக்கேற்ற மாதிரி ஐவிஎஃபை இண்டிவிஜுவலைஸ்டாக பெர்ஃபார்ம் பண்ணும்போது definitely it does not give rise to problems. Fourth thing is like, does IVF increases your weight gain, it increases your hair fall or something like that? Yeah, sometimes when we are using hormonal injections, it can give rise to 1 or 2 kgs of weight gain, but not more than that. Sometimes people attribute like, I have gained 10 kgs, 15 kgs because of that. No, it is not only because of the injections alone. That can contribute only 1 to 2 kgs of weight gain. The rest of the weight gain comes from the generally like associated depressions, low moods, or sometimes the stress factors which will not allow them to follow a routine healthy lifestyle practices can give rise to a weight gain. So the next thing is like, what is the success rates of IVF? Generally speaking, the success rates of IVF has to be categorized according to the individual couple's problem. You cannot like standardly say like this is the uniform success rate அப்படிங்கிற மாதிரி, but the standard success rate comes somewhere between 40 to 55%. Next thing is like how many times can we go ahead and do an embryo transfer? That has to be decided by the clinicians how many times it can be done. And next thing is like, is any operative procedure through laparoscopy or hysteroscopy is mandatory before an IVF? Definitely not. Only when indicated in certain scenarios you have to go through that. Can IVF be made more friendly to the couple without much medications? Yeah, there are protocols like minimal stimulations where you give lesser number of drugs, so it will result in like lesser number of embryos, and the transfer can also be done in a natural cycles where the exposures of the medicines to the couple can be minimized and it makes you friendly and happy. So I would like to conclude for this talk saying that as such, people need not look with a bad face towards IVF or with a sad face towards IVF, and need not feel ashamed that I have undergone an IVF at all at any cost, especially in this era. Always stabilize yourself through all natural modalities by following a good healthy diet habits, stress-free activities, as well as maintaining your weight. But on top of that, if you get through some medical conditions where the necessity comes that it has to be an IVF, you can do it happily and have a healthy outcome. Thank you.